Good morning, I'm Dr. Joe Mathew, and today we're going to talk a little bit about selection of artificial teeth in complete dentures. Now, depending on where you're listening to me from, there may be specific requirements for your course as to which textbooks you're supposed to follow, and so I would recommend that you go through your textbooks and identify the parts and the points that you need to grasp for your exam. Okay? The point of this lecture is to give you a broad overview and to help you understand what the selection of artificial teeth looks like in complete dentures and how to go about doing it in a sensible way. Primarily, you need to understand that selection of artificial teeth is more, especially the anterior teeth, is more an aesthetic parameter. It's not something that you can put lines and numbers to, but it's more of an aesthetic understanding. And so, as we go through the lecture, I hope you start seeing how you got to work around it and make your selection in the end. So like I told you before, I've taken different textbooks, Prosthodontic Treatment for Edentulous Patients, 12th edition by Zab and Bolender, Textbook of Complete Dentures by Dr. Charles Hartwell, Essentials of Complete Dentures by Dr. Sheldon Winkler, and of course, Textbook of Prosthodontics by Dr. Rangarajan and Padmanabhan. So these are the books I've referred to, taken points from, and certain other books as well. But I'm just going to quickly go through the topic. So, objectives in teeth selection. The first thing you want to remember is that you need to have a harmony with the rest of the face. When the patient smiles, you don't want to be drawn inadvertently too much to the smile, but it needs to be blending in with the rest of the smile. This is the first most important thing. Second, you need to maintain vertical dimension. You know, the lower face height is usually compromised or reduced when the patient loses his posterior teeth. So you want to open that up and make the face look natural. You also want to restore aesthetics. Dr. Boucher talks about the shock the patient has, the dangerous patient has the day after the extraction, when he goes up to the mirror and opens his mouth to brush his teeth and realizes that there are no teeth there. So this can be really traumatic, and so restoring the aesthetics, restoring the patient to what he used to look like is very important. The last one is to provide masticatory efficiency. Now here you must remember that no complete denture will by itself be able to provide the sort of masticatory efficiency that healthy natural teeth can provide. Okay, maybe an implant supported complete denture, not an implant supported overdenture, an implant supported complete denture, maxilla and mandible probably will reach close to what the natural teeth would, but otherwise they are always reduced. So when the efficiency is already reduced by virtue of the technology, be sure to select teeth that are of proper form so that you don't compromise on the masticatory efficiency just because you selected wrong posterior teeth. Okay, so these are things to keep in mind. And when you think about teeth selection, the first thing that pops into your mind is anterior teeth selection. Right, that's where the patient smiles, his primary phonations, aesthetics, all comes out of that. And this is very important for us. And so you must remember that it is about working together with the patient. You cannot do this on your own. Now, you need to understand the psychology of acceptance. Okay, every patient has an opinion. Every person has an opinion, especially about their teeth. They have an opinion, and it's important to receive the opinion of the patient. Patients should be given enough information so that the patient can actually make an informed decision as to which teeth they prefer. Now, very important is that you understand that the patient must be the one to select the teeth. Okay, I'll tell you why. Well, we have a vast array of teeth, shapes, sizes and colors to choose from, and as dentists we may be able to pick a shade and pick a tooth form and say this and that about the myriad of teeth forms and shapes and sizes and colors that we are possessing, but the patient may not be able to do that. So looking at too many teeth, the patient is going to be really confused and overwhelmed. So it's important that you help the patient to go in, to narrow down with a limited number of teeth, to help him go down and make a decision finally. But remember, the decision must be that of the patient. Okay, if the decision is entirely yours, when at the trying stage or at the denture insertion stage, if the patient or his relative doesn't like what he sees, the blame is going to be on your poor selection of teeth. So it's important that you allow the patient to make the choice. And as the patient narrows down, you can guide him to narrow down to something that is anatomically feasible as well. So I put up some of these notes like this here, a lot of text actually, primarily so that you can take down if you don't know where it's from. This is basically from Zab and Bolander's book. So if you are not knowing where it is, go find the book, or if you don't have the book, you can use the text. That's the reason why I put up this text out here. Okay, so you need to make sure that the patient is making the decision, and that way both of you get what you want, the dentist as well as the patient. Now, one important thing is that the patient's close friends or spouse probably is a very valuable input. So it's very important that you take their opinion as well. Don't just finalize a decision with the patient alone, okay? So get someone else to come in and give their opinion, and then you can make the final decision, okay? Another thing, it's psychologically important that the patient knows that you are involving him or her in the process. This makes the patient more accepting of what you are trying to provide, okay? And not just skeptical to what you're trying to provide, especially when they have giving some input. And the most important thing about a denture, complete denture, is that it has got this phenomenal ability to be really successful or really bad, okay? So a patient who's really happy with her teeth or his teeth is going to tell his friends about you. But if the patient is not happy with what he got, he's going to tell everybody about you. So you don't want negative publicity, so be careful that you understand the patient and help the patient to choose wisely. Okay. As we went through the topic, we looked at the objectives, we looked at a bit of an introduction as to understanding the psychology of acceptance. We're going to look at different other factors like anterior teeth selection, of which there are 3 different parts: selection of the shape, selection of the size, and selection of the color. And in the selection of the shape, you have form and contour, and you have dentogenics. And the selection of size, you have the width selection as well as the length selection. And in color, of course, you have general considerations as well as I just want to mention commercial shade guides and how to use them. Okay, and then we will end up looking at understanding the psychology of acceptance a little more in detail and how to guide the patient actually to make the selection. So we're going to look at that. Okay, so I told you there are 2 sides to the story. The first side is the dentist, who has this vast array of teeth in his repertoire. He has different colors, different shades, different sizes, and he must be able to narrow down and bring relevant shapes, sizes, and colors to the patient. And from there is where the patient is going to actually do the selection. Okay, so you're not throwing out the entire gambit of what is in your possession. You're just going to narrow down, and you can help the patient select from within that, because that will make it much more easier. And there is an ethical way to do it, okay? And we'll talk about that in the end when we talk about understanding the psychology of acceptance a little more in detail. But for now, how does the dentist go about selecting the teeth primarily, okay? So anterior teeth, especially at this point of time. So the first thing in anterior teeth selection will be the consideration for shape or the mold of the teeth, that is the form, how it looks, and the size of the teeth, mesiodistal, length, width kind of thing, and the shade or the color of the teeth. So these are 3 parameters we're going to look at. First, we're going to look at the shape or the mold of the teeth. In the shape or the mold of the teeth, we have 2 factors that we want to consider. Number 1 is the form and the contour, okay, and how it relates with the face as well as how it relates with the upper arch. And the second is the dentogenic concepts introduced by Frush and Fisher, and the factors that came out of it, that is the dynesthetic concept and the SPA factors. Okay, so first of all, form and contour. In form and contour, we're looking at facial form, facial profile, and we're looking at shape of the edentulous upper arch. So when we talk about facial form, we remember the facial form was described primarily by Dr. Leon Williams, who said that the shape of the central incisor has a relationship to the face, and he categorized the human face into 4 different forms: square tapering, ovoid, and square tapering. Okay, so with these 4 forms, he used what was called a true bite tooth indicator, and the indicator is basically a sort of a template. I'll show you a picture where there's a hole for the nose, an eye slot for the eyes, and there's a central marking to coincide with the median of the face, and there were vertical lines to determine the form of the face. Okay, so this is how the true bite tooth indicator looked like. So you would put your nose in here, your eyes would align out there, and your mouth would align out there, and there's these bolts that you can move up and down, vertical lines and horizontal lines, where you could categorize the face, and if you drew the outline of the face, you probably quite easily get it. So that's probably how it looks like when a patient puts their face into the true bite tooth indicator, and you determine the shape of the face, and as you can guess, that's probably going to be the shape of the central incisor eventually. Okay, so you have the basic form, which is a square, where your temple, your cheekbone, and your angle of the jaw is going to be straight. That's going to be a square face form. And you have a tapering face form where the temple, the cheekbone, and the jawline is going to be tapering down. You also have a square tapering form where the temple and the cheekbone are going to be straight, but the jawline is going to be tapering down. And you have softened forms of it for the female. So the male is a little more rigid forms, and the female forms are a little more softer, a bit rounded, if you notice, a bit rounded on everything. So it looks more gentle and more nice. And you also have the ovoid face form where you have the cheekbones that are most out, and you have the temples that are more in, and the angle of the jaw also more in, so you get a sort of a rounded facial profile, a facial form. So if I draw it schematically, this is how it's going to look. So you have square, you have a square tapering, you have a tapering, and you have an ovoid, and that's how the faces would look. Now if I were to look at certain of the celebrities, you probably know some of them, right? You have someone with a square face, you have someone with a square tapering face, you have someone with a tapering face, and you have someone with an ovoid face form. Now, one of the things you must remember about celebrities when you see them on the internet is that they all do makeup in different ways to make their faces look different, for depending on what role they are playing, or what character they are playing in their movie. But so this tells you something. When you have the patient in your chair, you need to make sure that you have the makeup primarily toned off, so that you can actually assess the face form accurately, and you can select the color accurately. If you have bright colors, bright makeup, bright clothing, it's going to be very difficult to select the color of the tooth. And if you have shadows in the makeup, you're going to have problems identifying the form of the tooth. So you need to tone down the makeup or remove the makeup completely, so it's easier for you to identify the face form and thus select the teeth. When you're looking at facial profile, we just talked about facial form. That is what you see when you're viewing the patient from front. When you look at facial profile, it's actually looking at the profile of the patient. Okay, so this is going to correspond to the labial surface of the anterior teeth. Okay, and that is from the incisor-gingival aspect when viewed from the mesial, okay, or from the distal aspect. So you take an incisor teeth, the incisor-gingival profile when viewed from the mesial or when viewed from the distal. This is what you're going to get when you look at it from the facial profile. So you basically have a face profile which is either straight, convex, or concave, and you determine this by measuring 3 points: the forehead, the base of the nose, and the prominent point of the chin. So you have the forehead, the base of the nose, and the prominent point of the chin. For this patient, of course, it is straight, so it's orthognathic profile or straight profile. For this patient, of course, it is convex, and so the corresponding teeth form would be like that. Okay, so I have a picture of bone as well as soft tissue contours here, and I want you to look at the soft tissue contours. Okay, so depending on what the maxillomandibular relationship is bone wise, you will end up having the soft tissue contours also kind of replaying into the similar fashion. So you see the profile being orthognathic, you see it's going prognathic, having a sort of a concave profile, and you're having a retrognathic which is having a convex profile. Alright, so this is about face form and face profile. The third thing we want to talk about was the shape of the upper edentulous arch. So the upper edentulous arch can be V-shaped, can be square, can be rounded. So based on this, you want to take the shape of the incisors. So if you have, you may have teeth that are narrower at the neck region. If you have a V-shaped arch, you may have parallel-sided teeth, incisors if it is a U-shaped arch, and if it's a rounded arch, you probably go for ovoid teeth. This is the way you select looking at the arch. So you got to keep these parameters in mind when you are finally bringing in the teeth forms that you want to and presenting it to the patient. Alright, so you have square ones, you have tapering one, and you have a ovoid form of teeth. Okay, the second one, dentogenic concept. This was described by Frosch and Fisher, and they selected the anterior teeth and really used 3 different parameters to refine their selection. That was the sex, the personality, and the age of the patient, and this is called the SPA factors. Okay, so in women, they believe that the teeth should be more rounded, and for men it should be more square forms to show more masculinity. And that's based on the sex. Based on personality, now the personality of the patient is the personality that you perceive clinically, not really the person behind what you see. In other words, what I'm trying to say is, don't try to assess the person's mindset. It's the personality as in the body build form that we are talking about when we talk about personality. So you're not doing an in-depth psychological analysis of the patient, you just wanting to look at the build of the patient and assess the personality. So in the personality, we are looking at the delicately built patient who probably would need to have teeth that are having softer edges and an arrangement that complements their delicate frame, their delicate personality. If you have an athletic, tough male, then you're probably going to look for more squarish teeth and arrangement that fits that personality, okay? And vice versa, you're going to work with that. Now, when you come to age, you're going to think about, as the age progresses, you're going to have wear facets and the teeth are going to become less visible, and so the incisal edges are going to get abraded. And because of all this, definitely you're going to have less display. You're going to characterize your denture to reflect that age a little bit more and to make it look a little bit in tune with that age. You can just imagine a 50 or 60-year-old patient coming in and you arrange artificial teeth that has mamelons on it or that look very, very young. It's going to look totally out of place with the mouth, with the face in total. So again, coming back to the concept of being harmonious with the face, get the harmony with the age of the patient as well. Okay, so if you incorporate these ideas, you're probably going to have a very pleasing effect in the final outcome of your denture. So yeah, so in this patient, very elderly patient, they've sort of incorporated the length of that recession into it, which makes it look very pleasing for her in her smile because it complements her age. Okay, what's the next? The next one is size selection. So we talked about shape or form, and now we're going to talk about size selection. In size selection, we have different aids to help us. One is pre-extraction records. The other one is the anatomic measurements that you obtain with respect to the face, the head, and all that to help you determine the width and the length of the teeth. Okay, and finally you have the post-extraction examination that's going to help you. So in pre-extraction records, you can use a lot of things. You can have radiographs, either it's an OPG or a IOPA radiographs. You can have an old photograph, let's say a wedding photograph, an old one where they are smiling, and you can kind of assess the display and teeth in the smile. You can also have diagnostic casts that you've made over time. You can have an extracted tooth that you have extracted yourself to verify the measurements. And you can always have a close relative who has a similar smile, let's say a mother and daughter Maybe the daughter's smile is exactly like the mother's. The mother says, oh, her smile, people always say her smile and my smile are the same. So then it's a good idea to get that daughter in, or at least her photographs in, to identify the size and the form of the teeth that you want to select. Anatomic measurements of the face, well, there are a couple of ones that have already been given to us. Actually, Berry told us that the width of the maxillary central incisor is going to be 1/16 of the bizygomatic width. So you take the bizygomatic width, you divide it by 16, and you should get the width of the central incisor. You also have the total width of the upper anteriors is the bizygomatic width again divided by 3.3. So the canine to canine is the bizygomatic width divided by 3.3. So these are two measures that you can use. Okay, and another method using the head, that's using the face, using the head, is the ratio of the cranial circumference, that is the glabella to the occiput, okay, to the width of the upper anterior teeth has been shown to be 10:1. So if your glabella to occiput is 10, then your anterior teeth segment should be about 1. That is the ratio that has been proposed. So these are all parameters that you can use to determine how close you are to the actual size. Then there is also the measurement of the face to determine the length of the teeth. We talked about the width, now about the length. So measuring from the hairline, okay, this is by pound. He said that the length of the upper anteriors is the distance from the hairline to the lower base of the chin divided by 16. So if you take from the hairline to the lower base of the chin and divide by 16, you get the size, the length of the central incisors, the upper anteriors, okay. So that is one way you can do. Suppose you don't have any of this information, and then you just have, the patient just walks into you and you have only the post-extraction records. Then you can use some anatomic landmarks. You can still use the Pound's method of determining the size of the anteriors, but you can use certain other anatomic landmarks as well. Number 1, you can use the contour of the mouth. 2, you can use the ala of the nose. 3, you can use the pupil of the eye and the contour of the mouth combination. 4, you can use the incisive papilla, and 5, you can use the cuspid eminences if they are evident on the cusp. So these are things that you can use. That's regarding anatomic landmarks. Then you can use the maxillomandibular relations, and you can also use the contour of the residual ridges. So we're going to look at each one of them, but first of all we're going to look at the anatomic landmarks. So in anatomic landmarks, before I get there, let me tell you also about the length. So we talked about width, and those are the ones. And in length, you also have the vertical distance between the ridges as well as the lips, and the lips have a couple of features that we want to look at to determine the length of the anterior teeth. So when you look at the width of the upper anteriors, looking at the anatomic landmarks, first one is the contour of the mouth, right? The contour of the mouth, you can mark it using an instrument on an occlusal rim. So have the occlusal rim contour to the right parameters, place it in the mouth, you see everything is pleasing. After that, make 2 marks at the contour of the mouth, and you should be able to get reasonably where the anterior teeth segment should be. When I say anterior teeth segment, I mean canine to canine should be. So when we talk about the width of the teeth, we saw the first parameter, and the second parameter is basically parallel lines extending from the ala of the nose onto the occlusal rim. This should primarily give you a tentative position for the apex of the canine, okay? So that will help you in measuring the width of the anterior segment. The next one that we're going to think about is using both the contour of the mouth and the pupil of the eye. And the patient is looking straight ahead. If you can mark parallel lines from the pupil of the eye onto the occlusal rim and mark the contour of the mouth, you can tentatively get a position where you can find the anterior display of the canine. You know the canine is not placed ever straight like that. It's always placed on an angle. So you know that a certain portion of the canine is visible from the front when the patient is smiling. And this anterior display can be seen tentatively when you measure the pupil of the eye and the contour of the mouth. So that will give you an idea of how much display in the anterior segment is going to come. Okay, so that's interesting. Another one is the use of anatomic landmarks like the incisive papilla. Now Schiffman has showed that the maxillary incisors will be about 8 to 10 millimeters in front of the point of intersection of a line that bisects the midline of the palate through the incisor papilla. So you have the incisor papilla, you have a line passing through the incisor papilla, okay, dividing the palate into two. And if you draw another line that divides the incisor papilla accurately across there, then the incisors will be about 8 to 10 millimeters in front of it. So this is one good position wise to know where the incisors should come. But interestingly, the line that actually bisects the papilla, when it comes on the outer edge of the occlusal rim, that would indicate the position of the apex of your canine. So that's interesting as well, because it helps you to determine that position as well. Yeah? Alright. The fifth one, if you have very conspicuous, evident cuspal eminences on your cast, if you have very clear eminence on the cast, that will pretty much help you determine where the canine was. Okay? In case you don't have, you can always use the buccal frenum, a line little in front of the buccal frenum as a position to start off developing your canine eminences. So remember that when you are developing your canine eminences, you are developing them primarily on the occlusal rim. Once you determine it on the occlusal rim, check it with harmony with the face. When that is decided, then you have all these parameters that you are going to measure out and check to know if what you have actually developed on the rim coincides with these parameters or you need to change it. The final assessment is completed or established on the occlusal rim onto which you are going to arrange your teeth. So the final decision is going to be made and settled or marked on the occlusal rim. Remember that. So you start off in the laboratory using different parameters, you work your way, bring it to the patient's mouth, put it in the patient's mouth, check different parameters, check the things I have told you, and then see if it coincides or if you need to tweak it to look harmonious. Once it is harmonious, you finally decide this is the anterior segment of this is the width of the anterior segment, this is the portion of the central incisors, this is the midline, high lip line, low lip line. Once you've selected those things and marked them on the rim, you're ready to go for the next step. Okay? The relation of maxillomandibular relations. Okay? How is it related to the teeth? Well, in class 3 arches, the mandibular anterior teeth usually are going to be larger because the mandible is larger and the maxilla is smaller. And in class 2, the vice versa. The mandibular anterior teeth are going to be smaller than normal. So, selection of teeth on a class 3 or a class 2 is also going to depend upon the maxillomandibular relations. Right? So, if you have a very narrow V-shaped mouth, you're going to either go for wider or narrower teeth based on the other parameters that you selected, and then you're going to set them in such a way that they're overlapped, or you're going to retain the size, but you're going to arrange it in such a way that's going to complement that V-shaped arch, okay? So that the canines are reasonably above the canine eminences, they're not too far back, and things like that, so that it complements that arch. In a broad mouth, again, wide or narrow teeth depending on other parameters, and then you're probably going to have to spread them out and use spacing in that kind of situation. If you just inadvertently make the tooth too large just because it's a broad mouth, you might end up having teeth that look too big. If you end up using too small teeth in a narrow mouth, you might end up having teeth that look too small and the smile looks too odd. So you need to select the teeth based on the other parameters. And then if you have a V-shaped arch or a broad arch, you're going to tweak the arrangement so that they complement and fit in well. So the upper anteriors, if you're going to say that they are less than 48 millimeters, the segment width, this is generally seen as small teeth. And if they are more than 52 millimeters, they are seen as larger teeth. Then, from there, how does the contour of the residual ridges help you? Okay, so the width of the anterior teeth can be again determined or can be guided by the contour of the residual ridges. See, the position of the artificial teeth should ideally fit into or follow the contour of the residual ridge. That is how the natural teeth were, or where the position was when they were present. But then there's a lot of problem because there's resorption, there can be trauma from a surgery or can be an accident, and all of this complicates the ridge form. And because of that, we are going to have to make certain compromises. Okay, So you need to remember primarily how the maxilla and the mandible resorbs. If you can remember this, then it's easy for you to remember, okay, where is the resorption happening and how it would have been, how should I extend my occlusal rim, and it should have been around this location, okay. Primarily the maxilla, when you think about the maxilla anteriorly, vertically and palatal, and the posterior portion is going to resorb vertically and medially towards the center, towards the midline. And the mandible, anteriorly it's going to resorb vertically and lingually, okay, and posteriorly it's going to be vertical again and slightly in a lateral direction. So the mandible is going to grow out as you look, as you see here. The mandible is going to resorb outward, making the mandible much more wider than the maxilla, which is resorbing inward. So this is where you start getting complications of tooth size, crossbite, all these things. So this is what you need to remember. If you have this idea, then you can more or less navigate your way. Coming to length of the upper anterior teeth, we talked about the width, we talked about different things, we talked about the length. We have two parameters we want to remember. One is the vertical distance between the ridges, and the second one is the lips. With regard to lips, we got to look at the length of the upper lips, the mobility, the vertical height of occlusion, and the vertical overlap when it comes to lips. Okay. So what is the vertical distance between the ridges? Obviously, if the ridges are wide apart or they are resorbed, giving more space, you have to have teeth that are bigger, right? Otherwise, they are not going to have the minimum amount of display. So the display of the denture base is something we really want to minimize. So you want to really show the teeth when the patient smiles. So if that is true, then and the ridges are really resorbed, you need to have longer teeth there. So it's important, okay? And you should be very careful to avoid trying to get disproportionately long or disproportionately large teeth, because that can look very bad. So sometimes you want to hide the denture base so much and you select larger teeth or longer teeth and it starts looking very disproportionate, very unaesthetic. So take care not to go into that boat, okay? Just select teeth that will have a minimal display, that will minimize the amount of denture based display, minimal display when the patient smiles and talks, okay? And sometimes the patient just wants their old gummy smile. In that case, you can, rework your length of the tooth so that you see a little bit of denture base as well. So that can be ways to work around that problem. So if you have a large intraocclusal space, obviously your anterior teeth need to be long. Otherwise, you don't get the overlap that you need. And if you have a smaller intraocclusal space, the teeth can be much more shorter. So the deal with lips. When you come to lips, the general rule is that you want the neck of the teeth to overlap 2 to 3 millimeter of the ridge, and when it is in that position, you want to show about 2 to 3 millimeters of display in younger patients and about 2 to 1.5 millimeter display in older patients. Okay, usually not even to 1.5 to 1 millimeter display in elderly patients. This is the general rule. Okay, so the modifying factors, of course, are going to be the length of the lip, the mobility of the upper lip, and the height of occlusion, vertical overlap, and all those things. Because if you have a lip that is not mobile, you're going to have less display. If you're going to have lips that are very long, you're going to have less display. So the lips are going to play a big role. So you're going to put it in the mouth, basically ask the patient to speak a little bit seriously, and then ask him to smile. Then you're going to assess if your lip length of tooth is good enough or not. So there are some tools for selecting anterior teeth, basically mold selectors, okay? So there are mold selectors and then there are shade guides, both of them are there. So mold selector, there was an old one previously used by Universal Dental Company. I got this picture from Dr. Charles Hartwell's book, and it was very interesting, okay? You have to place the guide on the high lip line of your occlusal rim. Once it is placed on the high lip line, you have this tool that can move, and this tool is going to coincide with the canine line that you have marked. When it does, the other leg of the tool will point to the mold of the tooth that you need to select. So it was an easy way of selecting, right? And then this transparent area you got to look at where the occlusal rim is coinciding with the line, and that would be your length of tooth. So that is how it was done, right? So the length was selected by the area marked length to a point where the length of the mold number intersects with the anterior occlusal plane. So you selected a small size, a medium size, or a large size. That is how you would select it. You also have a form selector from Ivoclar. Well, much more simpler these days. You just measure the area of the nose to get the width, and depending on that, you select an appropriate width of the maxillary anterior mold, select the desired tooth form, whether soft or bold, and then you select the tooth length. So 3 different steps in which you selected it. Okay. So within each of the packs, there would be so in one mold there would be a soft and a bold, and then there would be lengths on it. So you have a soft and bold. So once you selected that, there are different lengths of it. So you can choose the short one to the longer one. That's different companies, different ideas. Okay. So basically you can work with any shade guide. If you can know the anterior teeth width and you can know your high lip line to your incisal plane height, then you can pretty much select any teeth, because in all of the teeth shade guides or molds, they give you the width of the teeth, they give you the anterior segment measures, you can see all of them are there. So they give you all those parameters by which you can actually measure and select the right kind of teeth. Now most dental schools, especially in our part of the world, don't have very many teeth for selection. But that doesn't mean that it's not out there. It is available. So if you are actually looking for a personal case or looking for a patient in your clinic, you could go out there and choose from the variety of companies that are there. All of them will provide you different sizes in every different dimension, in the width, the length, the thickness, every dimension. So you can choose the one that really fits your need. All you need to know the anterior width of the anterior segment, that is your canine to canine width. You need to know that. You need to know the length that you propose from the high lip line to the incisal edge. What is the length that you propose? These many things, if you know, you can select your teeth comfortably. Color selection. Well, color selection obviously has got 3 dimensions: hue, chroma, and value. And color is really the sensation that the retina gets from the the stimulus that it gets from the light waves that are emitted off an object. So it's basically going to boil down to value, chroma, and hue, or rather hue, chroma, and value. And why do I say value, chroma, and hue? Because value is the striking thing the patient always notices first. The untrained eye sees the brightness of the color. So be careful selecting your parameters of color. Now, as far as complete dentures are concerned, there are a lot of proposals to use the hair, the eyes, the skin. Generally, the color of the teeth must really, just like the mold must be harmonious with the rest of the face, rest of the surrounding colors, primarily the skin. Okay, the eyes and the hair also have some role to play, even though with contact lenses and hair dyeing, you can always change all of that. Even skin tones are changed by makeup. So having a face without much makeup and selecting your color will be a really good idea. Okay, or a makeup that the patient constantly uses. If the patient constantly uses a certain type of makeup or certain tone of skin color makeup, then that's what you want to select with. The other one is with age. With an increasing age, the tooth color progressively becomes darker. So you don't want to set very bright teeth for an older patient. Young patients have light teeth owing to the large pulp chamber and the good blood supply. And as the patient grows older, the secondary dentin formation comes in. There's a little bit of enamel abrasion and all that stuff, creating a more darker yellowish color out of the secondary dentin coming in as the patient is getting older. There's also wear at the edge of the teeth, so there's loss of translucency, right? And teeth also pick up stain, making it look darker. So you need to be aware of all this when you are actually selecting the teeth. Now, sex. Generally, what we see is that when you finally end up selecting teeth, you find that you are selecting mostly a slightly darker teeth for men and shades that are slightly darker, just a tad darker and you find that you're selecting slightly lighter teeth for women. So this is something you can keep in mind and select according to your preference. The general considerations that are important in this is that you should view it at an eye level so that the most color sensitive part of your retina is actually working. You don't want to look down at the shade, you don't want to look up at it, you want to be at your eye level. Number 2, moisten your shade guide. You don't want to have a dry shade guide, it's going to look different when it's moistened. So because the reflectivity increases, moisten the shade guide. Use more than one tooth, don't just put one tooth in the mouth at a time. Use more than one tooth, at least 2 teeth at a time to select the teeth, appropriate shade and color of the teeth. Place it under the lip where its natural habitat is going to be, because it's going to have a darker background. The lip color is going to be different from the rest of the face. Place it under the lips and you get a better idea of how it's going to look. Okay, and you can always use the assistance of a friend or relative, so that it's not, it's not completely dependent upon you. The patient, a close relative or someone she trusts, can really give a good selection. Now, the other thing is, if you don't have anyone, select a shade that is slightly, edging on the lighter than the darker. Okay, and the other one is, of course, you want to check it under different lighting. All right, always check it under multiple lighting so that you don't end up with a shade that looks bad in different lightings. So try to keep it somewhere where the patient can see it in different lightings and looks good for the patient in all lightings. All right. So these are the different commercially available shade guides. You have Masad, you have Ruthenium, you have Kulzer, all of them giving different shades, and we'll talk about how you can help the patient select the shades when we come to understanding the psychology of acceptance later on in the chapter. All right, this is characterization. So after you select your teeth, do you want to characterize it? Do you want to actually bring some changes in color? For example, you use a maxillary shade of a different color and mandibular teeth of a slightly different color, possible, to give it more lifelikeness. Okay, are there changes in position you want to make? Do you want to grind the edges to make it look a little natural for the patient? Do you want to incorporate any restorations or any worn appearances? Most patients these days are not very fanciful of these things, but some sort of variations in positions and some sort of grinding seem to be still very much in demand, especially with celebrities who had that. So people who have that sort of a profile, a variation in arrangement, variation, some abrasion, things like that, they would like to maintain that teeth form so that no one knows that they're using dentures. So this is important for us to characterize it to each patient, depending on how keen the patient is on the characterization. As you spend a lot of time and effort for nothing. So assess the aesthetic level of your patient. Is the patient very demanding? In that event, go for characterization. Then comes to the point of the patient. So patient has a role in selection of anterior teeth. And this role, how important it is, it's as important because ultimately the patient is the one who's going to have the denture. So like I told you before, don't overwhelm the patient. Everyone has an opinion. Give them enough information to participate. Let the patient decide. Very important. Okay. Get them involved in the decision making because they will accept it better. Get a friend or someone who's acquainted with the patient to give an opinion. A satisfied patient will always tell his friends that you made it, but an unsatisfied patient will tell the whole world that you made it. So it's always important to get the patient involved. Now, how do we do this? 1, listen to the patient. The patient primarily came. Now, this part of this lecture is taken from Zab and Bolender. Okay, so it's there in the book. You can go and read it. Now, listen to the patient. The patient has primarily come to you for this reason, to get denture teeth. What is the primary need the patient has? Okay, what is his opinion about his teeth? Very important to note. Okay, so this is the first thing. Oftentimes we miss listening to the primary reason because we are so busy. We don't listen carefully, right? Second, let them give their opinion. Once they give their opinion of how their teeth looked, please reword it. Say it back to them so that they can correct you if you understood it wrong. Okay? So when you reword it, it clarifies what you really mean, what they really mean. The third thing you need to remember is that a spouse or someone they value can give very valuable feedback to finalizing the decision. Okay, so it's better not to just finalize with the patient alone. Patient and you alone, the patient can always remember and say, I thought you would do what's best. So always get a third person involved into it. Okay, identify, like I told you before, identify where your patient is. Whether she's like, it doesn't matter, or they have unrealistic expectations that cannot be satisfied. So identify where your patient is and work towards that goal. Number 2, get records of existing or previous teeth, or previous dentures. Okay, maybe you have old dentures, maybe you have old casts, maybe you have old photographs, maybe you have radiographs, whatever. Get the records. Okay. Now remember one thing: make copies of the things patient liked. Now the patient may not want to give you her cast, or you may have the cast. Maybe it's okay. Maybe the patient doesn't want to give you the photograph. Take the photograph, make a photocopy of it. If you destroy the photograph in any way accidentally, that will be a big loss. So always make a copy of what the patient likes and retain it for your use. You also want to maybe have a copy of, have a note of what the patient doesn't like. Okay, so I explained to the patient that the mouth would have changed a lot by now. It's not easy to imagine how it looked before. So I really need some help from you. I need your old photographs. I need anything you have, old radiographs, maybe if they have casts, old dentures, to help me know how it looked like. So that can be one way of requesting the patient to help you give better results. Okay, you can make plaster models of the denture that best satisfied the patient. That way you have a reference with you all the time. Okay, photocopy whatever picture you want, right? Relevant pictures. You also maybe want to note down what the patient does not like, because that patient doesn't really want to see. So reorganize your arrangement to avoid those things. Okay, use the positive records to provide a better denture with similar teeth, but maintaining a new vertical dimension, right? A better vertical dimension because now the teeth is all changed, and a better adaptation to tissue because the tissues are changed. So these are the 2 things you want to change in the new denture while retaining the values of the aesthetics of the old denture. The positive input, incorporate them. The negative input, stay away from them, avoid them. Okay. Sometimes the anatomy will demand that some compromise or change is made. Inform the patient, this is how it is, so we can't do some particular thing, and make that compromise. Okay. And you also need to assess the tolerance or the motivation of the patient, how much the patient is willing to make the change. So some anatomical parameter really reduces or really demands a compromise. See how much the patient, tell the patient and inform the patient and motivate the patient towards that place where the patient can really accept it and work within that range that they can accept. Okay, so you need to set up your practice to be anterior tooth selection friendly. You can't have a practice that does not have the basic needs. One, you need to have, I put this up because it is, maybe some of you won't get the books. Okay, that's the reason why I put it up. But what you need to know is, one of the things with the north facing window is that it's always softer, duller lighting, doesn't cast any harsh shadows. So your selection of teeth is going to be more or less straightforward. Okay, if you can use corrected lighting in such a situation, you are going to have very good results. Okay, so this is the big thing about a north facing window. Now every other window, an east facing, a west facing, depending on the time of the day, you're going to have harsh lighting coming in, and that's going to mess up with the color selection of your teeth. So that's important. Okay, otherwise what you need to do is you need to cut out natural light completely and go for color corrected lights, and that's going to be very difficult in the practice. We want to have some sunlight into the operatory. Okay, so the other important thing you want to have, you want to give a slightly larger, slightly oversized mirror to your patient, about 6 inches or 15 centimeters diameter, so that the patient can see how the face looks. If the mirror is too small, the patient is struggling to see. The mirror is too large, there are too many distractions happening. You can't see the patient, right? Because the mirror is covering patient's face. Excuse me. So these are things that you need to take care. Give a 6-inch mirror. Patient can see her face completely. At the same time, you can see the face as well. Okay, and then help the patient to select the teeth. Okay, so allow your patient to select the anterior teeth color. How do you do that? The patient may just say that, doctor, you choose, you are the best, and it's very easy to fall into that category where we think that, yeah, I know and I can help. It's true, but the best that is to be able to guide the patient to selecting the teeth. So, if your patient likes your decision, then that's great. But if the patient doesn't like your decision, then it's your decision and your selection of teeth. So it's important. Okay. So it's a good idea to avoid this by insisting that the patient selects the teeth, and do this in a non-threatening way. And this is done by using a method of comparison. It is basically a simple choice of between two options. Every time it's just two options that come up, and you choose between that. The same technique that our ophthalmologists use for selecting your eye powers. They use the method of comparison. So that is really what you want to do. Okay. So color is the easiest thing for the patient to decide upon. Patient will say it's too bright, too soft. It's usually give them, you just give them the shade and tell them to select which is the darkest one, which is the lightest one. So the whole range is there, and they can select easily which is the darkest one. So that concept is understood. Once the patient can see the differences and agree with you, then you can start the process of actually guiding them. Okay. So when they ask them to point to a color that they like, when they point to a color that they like, then you're going to isolate that segment, and out of that segment you're going to pick out, remove the rest of it. Out of that segment you're going to pick out 1 or 2 teeth, and you can select the method of comparisons. Okay. So 1 or 2 repeated comparisons, and you're reaching your decision. I don't think you will go more than 2 or 3. Okay. So you compare between 1 lighter, 1 darker, and then if the patient doesn't like the darker one, use the lighter one and go for a lighter more than that, and you know where you're going. So very quickly you can come to selection of color. Okay. So that way the patient selects the color, and then what you can do is you can reverse the colors. You can just keep the one the patient selected, and the one the patient said is too light or too dark. Just reverse the colors and ask her to select again. Most probably she will select the right color again. So that helps us confirm the color that she wants or he wants, right? You can also try another color within the preferred shade range, okay, just to mess it up. The one that she liked or the patient liked, and another color, and just see what the patient selects. So again, patients usually select the same thing that they wanted, right? If they are unable or unwilling to select, then what do? Then you take the 2 shade tabs. Between 2 shade tabs, you are not able to select. You take the 2 shade tabs, ask the patient to look at something that's got a light blue background so the eyes are relaxed, and then you just flash the shade tab and you ask them which is the tooth they notice. Okay, or keep it under their lip and ask them to look in a mirror and which is the tooth that they notice. So when they notice a particular tooth, that is a tooth basically that you want to avoid, because that one is probably the brighter one and probably going to draw attention to, and so maybe that's the one you want to avoid. Okay, the one that is less conspicuous is usually the better color. If the patient still cannot decide, you can always ask someone else to help, but you can always tell them that both the shades that they selected are good. That can give very pleasing dentures. Now, what we really want them to do is to select between that. So to help that, you can bring in the entire set of anterior teeth, not just a single tooth. The entire set in these 2 shades, and when they see the entire set, they're probably in a better place to select. So that's the way you can go about helping the patient select anterior teeth. So remember, in a practice, what is important is that the vast gambit of teeth that are available to you: shape, size, form, color, everything. Now you need to help the patient narrow it down. So you got a selection, and you know that the patient is invariably going to come here because you have got a scientific basis for your selection. So you show the entire shade spectrum, color spectrum, and the patient is going to select that, and you're going to guide the patient down to the right color. You're going to show the form, the shape, and let the patient select right, between what you have selected, because the patients very quickly will narrow down to one because they can identify with that tooth because they have seen it in their mouth before, or it looks similar to what they saw in their mouth before. Okay, so the anterior teeth size. Choose a size that is appropriate based on existing dentures, models, previous teeth, photographs, whatever. Okay, and then you can measure this millimeters, take a similar size. Even so, the patient may have an opinion. They are too large, they are too small, right? Usually, they're a matter of rejection. They point to one and say, "This is too large." That means I don't want it. Or this is too small. That means I don't want it. So it's a reference. It's one of rejection, not of preference. But you can still use it to get ahead and select the teeth. Okay. So you couple with the actual measurements that you made, along with the method of pair comparison, you can really narrow down on what is the size that the patient prefers. Again, you can, if the patient is struggling, you can set these two teeth that the patient's confused about onto a strip of wax and put it under the lip to find out which one the patient prefers. Okay, so that is also there. All right. If the patient is, again, the patient's preference may be pointing to one that she doesn't want, so that will help you to choose the one that she does want. And if it's still difficult, personally I would suggest do an anterior try. Just set up the anterior teeth, okay, and show it to the patient. Patient is not happy, you can, modify one side with another mold, see how the patient feels, and select between the two of them. It's a lot of work, but yeah, if there's no other way, that's one thing that you can do. Help your patient to decide the mold of the teeth. Now, of the three, the patient easily select the color, reasonably be able to select the size, and this mold is the one that's a little difficult for the patient to select because it's more not so obvious to the patient. But this is what really gives the finishing touch to it. Okay, you can have same size, but the appearance can change because of the difference in the crown taper, the labial curvature, and things like that. And this is really what gives the finishing touches to the denture. So previous models of photographs, if you're making an immediate denture, you have the tooth. So these things are really going to help quickly determine the mold that is needed. But in case you don't have any of this, you can allow the patient to decide between molds of the same size but different shape, right? So you have teeth of the same size but different shape or different mold, and you can ask the patient to decide. If the patient is not able to point to one, you're always using the method of comparison, so you can always narrow down to two, and from those two of the same size, you can put them on a rope of wax, put it in the mouth, have the patient decide on that. And if the patient still finds it very difficult, there's one easy way: do anterior try-in, one half with one mold and another half with the other mold, and the patient should be able to reasonably point to you which mold she prefers or he prefers. And that way you can bring in the anterior teeth selection with all the wisdom that you have, all the knowledge that you have, and bring in the patient as well into the process of selecting and getting the right size teeth. You have the right selection and the right arrangement, you have an awesome looking denture which looks very natural, and the patients will be really satisfied. Thank you. Have a great day.